Welcome to Aging Well with your co-host Alice Liu. Today we have a very special guest, Dr. Bryant Lin. He's a primary care physician, educator, and researcher at Stanford University. He focuses on primary care and population health and is also the director of medical humanities and arts.
Thanks
So,
for having me.
it's really nice to meet you, Dr. Lin. Could you share more about your primary research and clinical practice focus?
Yeah, I have a kind of an unusual a practice in that I do many things. I'm a primary care doctor, which is in the States is really you're the first stop along the care route for most patients. So we see patients in urgent care, but for chronic disease and continuing care. Also, a few years ago, I started a diagnostic clinic, which I no longer run, but handed over to one of my colleagues. So this is sort of a medical mystery clinic that comes in. And then also a few years ago, I co-founded the Center for Asian Health Research and Education. So that's a center focused on research and education on health issues that differently impact Asian groups, but also bled into my clinical practice, where, of course, I have a lot of Asian patients asking about specific issues such as normal weight diabetes, non-smoker lung cancer, stomach cancer, that differently affect Asians than other groups.
So you've mentioned how Asian groups are differently affected by certain illnesses. Could you touch more on that?
Sure. So many diseases can impact Asians differently. So probably the most common one is diabetes. So Asians, both East Asians, Southeast Asians, and South Asians can develop diabetes at lower BMI, body mass index, or lower weight. So among Caucasians, the risk tends to go up at higher body mass indexes, 25, 30 BMI. So 25 to 30 is overweight, 30 plus is obese. So the risk goes up from BMI of 25 and upwards to have diabetes. But for Asian groups, it's really a BMI of 23. So it's really what we consider a normal weight that you would have an increased risk in diabetes. And then, of course, there are other diseases such as lung cancer and never smokers that differently impacts Asians, especially Asian women. Asian women have 2 times or greater the risk than non-Asian women to develop never smoker lung cancer. I was not as an Asian woman, but as an Asian man, I was diagnosed with lung cancer in May, and it also affects Asians differently in that when we get lung cancer, when never smokers get lung cancer, we get a tumor mutation that's much more common in Asians than in non-Asians. So this is called an EGFR mutation. So over 50% of Asians who don't smoke, who have lung cancer, have this tumor mutation, whereas in a non-Hispanic white population, less than 20% have this mutation. So these are various ways. I mean, I can go on and on about increased risk of stomach cancer in East Asians, increased cardiovascular risk, heart attack risk in South Asians. We don't have enough time in the show to go all through everything that Asians are just differently impacted by, but there are many things, and this is an increased area of research, and we're trying to, as part of my center, to really get more resources, education, and attention to this area of research.
So let's touch more on the fact that you are an Asian non-smoker who is diagnosed with lung cancer, and you're also a respected medical professional. So could you tell us about your unique journey throughout that process?
Absolutely. I have one foot in both worlds as a doctor and a patient. So I would say one part of my unique journey was when I was diagnosed. I was kind of a typical late stage cancer, stage 4 cancer patient. I had the only symptom I had really at the beginning was a cough. And cough is very common, right? Many people have cough, and vast majority don't have any cancer and will never develop cancer. But I had a cough. I thought it was allergies. I got treated for allergies. My own primary care doctor sits, a few seats down from me. I see him every day in clinic. So, I had very easy access to care and was very fortunate to be able to get my diagnosis very quickly and to get connected with care very quickly through Stanford. So I would say I had a relatively straightforward journey, unlike most people in their journey to get diagnosed and treated. I'm very fortunate that happened. I'm also very fortunate with this mutation I talked about. That does qualify me for a targeted therapy. This medication called Tagrisso, brand name is Tagrisso, osimertinib is the generic name. And it's really an amazing drug that has enabled people to live longer and have a higher quality of life with lung cancer and with this mutation. So it's really amazing that we can benefit from this new technology, relatively new technology, which are tyrosine kinase inhibitors.
Right. Well, let's touch more on the lung cancer in a little bit. You mentioned that you explore a diverse area of different things. Could you maybe touch on like the basics of what you're really focusing on right now?
Yeah, so the other area we haven't discussed is medical humanities. So I'm the director of medical humanities and the arts at Stanford.
Mhm.
And medical humanities is defined differently depending on which university you're at and which part of the world you're in. At Stanford, we really define it as at least in the medical school, it's less of an academic approach than a programmatic approach. So we're really focused on providing training programs, educational programs, community programs that are based around learning skills, around storytelling, around listening, around observation, but also just the enjoyment of the arts. So something that I think we all intuitively feel, and there's lots of studies to back this up. The participating in or observing or watching or listening to the arts has really been shown to be beneficial for our mental health, for our well-being. So we really take that approach in our program, and we've done a little bit of research in the area, but we're really focused on delivering excellent humanities and arts-based programs to our community.
Yeah, speaking of that, you are quite interested in storytelling as well, right? And you dabble in filmmaking and other creative pursuits. I know that you've done quite a few projects that interweave those two things together. So could you tell me about those?
Yeah, absolutely. About 4 years ago, a group of students and I came up with this idea to do a documentary on a local nursing home that for Japanese Americans. So this is an amazing nursing home called Umanoki, and they were founded on the grounds of a Buddhist church, which is pretty unusual. The Buddhist church had extra land, and they recognized the need to offer a resource to care for their aging population. And so we went through this great process of developing a documentary about a couple of families who their loved ones lived their last days at this nursing home. And so it was a great experience for me to learn about filmmaking in this aspect and to work with the students on this. And I think it's just an example of how, for your show, aging, as you age and as you go through life, continuously learning about new skills and experiencing new things is really important to keep yourself engaged.
Wow. Would you want to do more filmmaking like that in the future?
Yeah, absolutely. Unfortunately, with my diagnosis, I have to really be selective about what I choose to do or to do not. But absolutely, I'm very open to that. And as you can see, I do many different things, and they kind of I depend on serendipity. If the resources and time line up appropriately, then that's a great time to take on the project. But I no longer have this timeline of maybe something can take 5 or 10 years. I'm looking for things that have a shorter timeline.
Back to the lung cancer now. Given your experience, how do you advocate for lung cancer prevention and support for others facing this disease?
Yeah, it's been really a roller coaster experience for me. I have stage 4 lung cancer, which is not curable. So I have a limited lifespan at this because of the lung cancer. The 5-year survival rate for stage 4 is around 9 or 10%. So only 9 to 10% of people live beyond 5 years with stage 4 lung cancer. And, the experience has been just amazing, but it's really highlighted to me what people can do to really make sure they're getting adequate care. So, first of all, having excellent caregiver support. So, some people have excellent caregiver support built in, like me. I have a great wife and family, and my sister's also a physician. But not everyone has that. So, seeking out friends and support from other people in the community who may have gone through this can be very helpful. There are also cancer navigators and cancer advocates or patient advocates who can help you on your journey. So if you don't have that built into your family, for me, of course, I'm a doctor, so I can ask myself, well, what should I do? I can talk with my colleagues, but for other people, you may need to have somebody advocate for you or help you navigate the system, which in the U.S. Relative to Canada is much more complicated. But any healthcare system is very complicated just because of so many factors involved in getting diagnosed. The other thing is really focusing on the other things are focusing on taking care of yourself at home. Nutrition is a huge factor. And I think from the medical perspective, we silo it down to one of many things you need to be doing getting cancer care. So getting appropriately, we're seeing a dietitian or really thinking about what you're eating and how you do this and how you get food at home is really important. And how you're getting food that maybe you can tolerate during chemotherapy is very important. So getting those resources. And then, the other thing that is kind of I'm going to go through mainly the non-medical things, is spiritual care. So, this is something that I did not grow up as anybody with any, I didn't go to church. I went to a faith-based high school, but beyond that, didn't have any organized religion in my life. But, it's amazing since I was diagnosed, people from various religions have come to me and wanting to pray with me, pray for me, chant with me, light a candle for me. And, that's really been amazingly impactful that people would do this from different religions and in different ways. So I think, getting some sort of spiritual care, maybe directly or indirectly through your friends, through your family, or directly, I think that's important for many people. On the other side, I think, just policy and advocating, there are a couple of parts. So one is screening. So recent study from Taiwan, they screened people at risk who had a history of secondhand smoker exposure, as well as a family history. And through low-dose CT scanning, they were able to detect over 2% of the people they scanned had cancer. 2%. That is tremendously high. To give you an example, in the low-dose CT scanning screening for smokers, it's around 1% detection rate. So with the appropriate criteria, low-dose CTing can really save people's lives. So hopefully this is relatively new research. It's not covered in the US. I bet it's not covered in Canada. But, if you have the resources to go back to your home country or to pay for it, this is maybe something you could consider. There are no guidelines regarding this, but, just, I talk to my family and my kids. I'm like, well, you better get screened when you're 40, 45, so you don't have to go through what I am going through. And lastly, at some point I'm going to become resistant. My cancer is going to become resistant to the chemotherapy, the targeted therapy I'm on, which is that miracle drug I talked about before. And, we need continued resources and research and investment in developing our next generation of treatments and targeted therapy. I got this early on. I spoke to a pulmonologist who had stage 3 lung cancer, and he made a great observation. He said, "You only have to live long enough until the next treatment comes out." So, purely selfishly, I wish that we can speed up progress. So, through our center, we're trying to raise resources and attention and education around lung cancer. So, we are going to start publishing some information soon. Not yet. We don't have a great kind of synthesis of information yet on our website. But if you go to asianhealth.stanford.edu, you can get information about all the Asian health issues that we talked about today. But in the future, stay tuned. We're going to have some information specifically about lung cancer in never smoking Asians as well. So hopefully that can be of benefit to you.
Well, firstly, I'm really sorry to hear about your diagnosis, but it's amazing that you're trying to raise the resources to do something about that. Well, thank you so much, Dr. Bryant Lin, for coming on to our show, and I hope that our audience was able to learn something fun today. Thank you for watching Aging Well with your co-host Alice Liu, and may we be forever young.